It's a mindset. You have the power to choose. You need to look for ways to move. It's not built into our society like it used to be. We don't hunt and gather anymore the way that our bodies were designed to do. Our bodies were not designed to sit for long periods of time. They just weren't. Now, here we are. We lay down in our bed for 6, 8 hours, however long we sleep. We get in our car for 20, 30 minutes to drive to campus. Then we sit at our desk for 8 hours a day. And then we get back in our car and we sit for 30 more minutes to drive back. And then we might even sit on the couch for the rest of the evening. We simply are not made for that.
You're listening to Becoming Wildly Resilient, brought to you by University of Kentucky Human Resources, Health and Wellness. In this series, we'll explore a variety of well-being topics with experts from the university community in physical, emotional, nutritional, and financial health. Join us, and together we'll discover how we can thrive at work, home, and beyond. Thanks for joining us for the second episode of Becoming Wildly Resilient. If you're joining us for the first time, welcome, and be sure to go back and listen to our first episode titled Living Truthfully with certified health coach Jackie Hansen. I'm your host, Jakob Hester, and today I'm joined by Carrie Davidson. Carrie's the MoveWell Fitness Manager with UK HR Health and Wellness, and she recently earned a doctorate in health promotion from UK as well. She's got a long list of credentials to go along with that. She's a certified exercise physiologist through American College of Sports Medicine, a registered yoga teacher with over 500 hours of training, as well as a certified group fitness instructor, mind-body specialist, and functional movement specialist through the American Council on Exercise. If this wasn't impressive enough, she also has a level 2 exercise as medicine credential and is the national co-chair for the ACSM's Exercise as Medicine on campus. Today, we're talking about developing a mindset to move, whether that is to get moving or to keep moving. So thanks for joining us, Carrie. Before we jump into our conversation, if you'd like, just tell the listeners a little more about the person behind that impressive list of credentials I just listed off.
Yeah, so I'm a person who likes to be busy. I think you can see that. Besides doing this fabulous work at UK, then I also have 3 little ones that I get to take care of and get to be mommy on the off hours.
Carrie is one of my colleagues as well, and Carrie's the one who hired me 4 years ago. So I started out as an exercise consultant with Carrie doing things with MoveWell. So I'm really excited to dive into this conversation because it aligns a lot with my background. So Carrie, I mentioned your involvement with the ACSM's Exercise as Medicine on Campus initiative, and you're the national co-chair. Can you tell listeners a little more about that initiative and the recognition that the university just received as well?
Yes. So ACSM has an initiative called Exercise as Medicine, and it is a global initiative. And so we sort of parcel that out into different groups. And so for our group, we work on campuses across the globe to try to get exercise as medicine programming happening on different campuses. And what that really means is what we want is for healthcare providers at all the well visits or even sick visits in some places, but we want healthcare providers to ask physical activity as a vital sign. That's sort of our thing, PAVS, physical activity as a vital sign. And so we want them to ask their patients if they get 150 minutes of moderate intensity exercise per week, if they're doing strength training, if they're doing these regular ACSM guidelines. And if not, then the second step or the second objective of exercise as medicine is really to refer then to a qualified fitness professional. And so, qualified fitness professional should be in quotes and not capitalized because there's several different certifying bodies out there. There's some really illegitimate ones online. And so you have to be careful when you do that. That's why Exercise as Medicine created credentials then. And so they've worked with the other groups to sort of find the equivalencies. And so then they can say, okay, you've got that certification, you're a level 1 or a level 2 credentialed Exercise as Medicine fitness professional. And so we just started this program here at UK about a year ago with the Women's Health Clinic. And so what we did was we worked with UK Healthcare IT. We got the physical activity as a vital sign question put into the electronic medical record. which was a really big deal and took a really long time. So we got that in there. We educated the providers over at Women's Health. We worked closely with them. They were very excited about this initiative and they were on board. As you might imagine, most healthcare providers want to see their patients get better. They don't want to have the same chronic issue for years and years and years. They want to see their patients get better. And so they were really on board and they were excited to work with us. And so then we had some goals that we set out and we started to meet those goals and referrals. And then Ryan, the other exercise physiologist that works with us, Ryan and I worked with the patients then and did 3-month follow-ups and 6-month follow-ups to find that we really were making a difference in the minutes of exercise in people's lives. And so with all of that, then ACSM and our Exercises Medicine on Campus committee, we recognize campuses at different levels for the amount of programming that they have and the quality of that programming. So there's a bronze, a silver, and a gold. So here at UK, we just achieved the gold level recognition for Exercises Medicine on Campus because of our pilot in Women's Health, where we got the PAVS question in the electronic medical record, and also because on the student side, that they had already worked this into University Health Services. They'd already worked this into their system, which is separate. And so we were doing it on both the student side and the employee side. So yeah, we just received gold level recognition for the University of Kentucky.
Yeah, I know you guys are very happy. I know it was a ton of work and are really excited to get that recognition for all the hard work you've put in for that pilot and how beneficial it has been for people. So we're really excited to see how that grows from here too. So something you mentioned in your explanation there were the ACSM guidelines. So I think that might be a good starting point just to reiterate those for people, just to know what the ACSM does set as goals for people to get throughout the week with physical activity.
Yeah, absolutely. So ACSM, just as a reminder, is the American College of Sports Medicine. So they're really the gold standard and the unifying body of all physical activity. And they work with the Surgeon General. So those things are one and the same. And so they put forth guidelines for all modes of exercise. So for cardiovascular exercise, they recommend, now remember, this is just for general health benefits. It's not necessarily to lose weight or lower your blood pressure or have one of those specific goals. Their guidelines or their recommendations are really just general health benefits. And so what that says for cardiovascular exercise is 30 minutes moderate intensity exercise 5 days a week, or you get the same health benefits if you do 3 days a week, 20 minutes vigorous exercise. So that's the cardiovascular recommendations. The strength training recommendations, these can really vary depending on what your personal strength goals are, but the general guidelines say 2 to 3 times a week, 2 to 3 sets, 8 to 12 reps, major muscle groups. And so again, that's really where you need to work with somebody who's got some credentialing and got some knowledge, a personal trainer, somebody that's certified to help you to figure out what that looks like to meet your goals. And then the third mode is flexibility, mobility. And the guidelines there say you should stretch all major muscle groups. So you can think of these as surrounding joints. Take them through their full range of motion. Hold those for 30 seconds of static stretching 2 to 3 times on most days of the week. So those are the guidelines for ACSM for cardio, strength, and flexibility.
I think that was important to cover because we'll probably touch on these points throughout this conversation as well and how those guidelines integrate into our conversation. So I feel like it was a good time to go ahead and bring that up. So this kind of transitions well into my next point too. So tell me if this sounds familiar to you. Someone is getting started exercising. They have a goal. Maybe they call it losing weight and toning. So kind of this sort of nebulous goal out there. They scroll through multiple blogs, websites, YouTube, what have you, to discover those hot new fitness trends. If and when they finally pick a routine or a plan, maybe they even pay for one, they immediately go from 0 to 60 on it, really, and manage to keep it up for a short time usually, but ultimately end up feeling burnt out with it. They're too sore to continue, or worse, they end up injured. Is that something that you commonly hear?
It is something that I hear. And usually by the time people get to me, like in a one-on-one consult or whatever, usually by the time they come to me and we're having a discussion about it, it's because they've got injured and now they need to know what they can do safely. So that's kind of my specialty, is I can work with a lot of different conditions. And then the other thing is, if they haven't gotten an injury, it just didn't stick. And they just let it fall off, and they weren't motivated, and it wasn't really for them. It seemed popular at the time, or some magazine or some famous person really endorsed it and hyped it up, and so they decided to try it, and it really wasn't for them. And exercise is personal. It doesn't have to look the same for every single person. Those guidelines that ACSM put out are guidelines. My 150 minutes of moderate intensity looks different than yours, I'm sure. Or my, even my 20 minutes of vigorous probably looks different than yours. And I can guarantee you this is true, because I'll often go for runs with some of the other fitness staff. And even if we run the same distance, it looks way different.
Yeah, and I want to reiterate to people that this is not uncommon, and we ourselves are not immune to this either. I personally, I've gotten burned on this quite a few times. You mentioned running. That's where it's happened to me. And most recently in the fall, I actually used to be a track and field and cross country coach. And so I took kind of a hiatus from running and decided I was finally ready to get back at it. And in the fall, I bought new pairs of shoes. I got everything ready and started off. And I was like, oh, I can definitely do X, Y, and Z. And went out there, and lo and behold, 2 weeks later, my shins are far too sore to run again. And it's like I've had to go find another source of exercise again and stick more with walking and any other types of cardio that I enjoy. So don't feel like you're out there alone if that's ever happened to you. So that's sort of what we're going to talk about today. So you mentioned kind of getting towards almost mindset. So I'm curious why that is. Why does that, if you can briefly kind of tell us why you think that happens to people, particularly those getting started for the first time or the first time in a while?
Right. I think one thing is that people honestly don't know their own mind. So if you have been a runner for years, like you have, then that was naturally what you were drawn to. And that's something that you wanted to jump into. And people don't realize also that things change as you get older. Your motivations change. Your goals change, your body changes, things change as you get older. So, just because you did something when you were 18 doesn't mean that you still want to do that or should do that when you're 40. So things change. So it's really about our mindset and how we approach our exercise. And so just because somebody sees it on YouTube or sees an infomercial doesn't mean it's right for them. Now, their interest might be piqued, but that might not mean that it's good for them. And so really, I think what people have to dig deep and find out is, first of all, what is their goal? What are they trying to do? And so I always tell people, you want to train for your life. If your life is, playing a professional sport, your training looks like that professional sport. You train for life. My life looks like I'm a mother of 3. I work full time. I want to be able to do my job, do it well. I want to be able to be a mom, to stay healthy, to take care of my kids. I teach yoga on a regular basis. I want to be able to teach yoga. I want to be able to help people improve their well-being. That is my goal. That is what I want to do. And so that's the reason I train the way I do. So I don't run every day. No way. I don't love it that much. My body couldn't take that either, probably, even though I don't go a very long distance. I do yoga almost every day. It's a much more gentle exercise mode. And even that looks different day to day. And I do strength training 2 or 3 times a week. So I try to get a balance of all of those things because I want to train to make my life the most efficient, healthy, the best that it can be. I want to be able to do the things that I want to do.
I think one of the points you talked about in there that is really interesting, and I think is where this concept of resilience and the entire idea behind the podcast, where that intersects with physical activity. Because if you think about physical activity and resilience, you may be sitting there wondering, how do these really connect with each other? But I think you touched on that point when you're talking about how life changes, how your goals change, how your body changes, how your things in your life, whether that be your schedule or your job or having kids or anything like that. That's where we see this intersection of resilience and things like physical activity. So they're not mutually exclusive ideas. And I think what happens to people a lot of times too is it's easy to fall into that trap of thinking that this is only happening to you. And if you don't get that immediate success, you kind of spiral out, and that really negatively affects your self-efficacy too, which is really just your perception of how you feel like you're able to perform whatever goal that may be or whatever behavior that may be. In this case, it could be running, it could be strength training, anything along those lines. So how then can people shift their mindset towards physical activity and give themselves the best chance of sticking with it? You kind of touched on that a little bit already.
Yeah, I think people forget that they have the power to choose. I've seen this over and over again, especially with, I'm not going to put a generation on it. I'm going to put some other details around it. So people who tend to have a sitting job, who sit for 8 hours a day, they tend to have injuries. They tend to have pain. They tend to not move around enough. And they tend to have a mindset that they don't want to get up. But they forget they have the power to choose what their life looks like. So, my job sometimes does require me to sit for long periods of time. And so I have found ways to move. I have a standing desk. I'll stand part of the time. I'll sit part of the time. If it's possible for me to walk around while I'm having a Zoom call or a phone call, I'll pop in some wireless earbuds and maybe walk while I'm having a meeting. We would have walking meetings. I find reasons to get up. It's a mindset. You have the power to choose. You need to look for ways to move. It's not built into our society like it used to be. We don't hunt and gather anymore the way that our bodies were designed to do. Our bodies were not designed to sit for long periods of time. They just weren't. Now, here we are. We lay down in our bed for 6-8 hours, however long we sleep. We get in our car for 20-30 minutes to drive to campus. Then we sit at our desk for 8 hours a day. And then we get back in our car and we sit for 30 more minutes to drive back. And then we might even sit on the couch for the rest of the evening. We simply are not made for that.
And do you see this as a sort of a universal approach? So I mentioned initially people who are trying to get going for the first time or maybe first time in a long time, but does that really differ to if you say we are like now currently we're immersed in the COVID-19 pandemic. So that's changed a lot of people's work routines. Maybe, like I said earlier, maybe you have a new child, maybe you have a new job, life circumstances changes. Does that shift in mindset and that, I guess, that power to choose, do you look at that differently, whether you're focused on getting started or responding to any sort of change?
I think the mindset is the same. Like, I need to find ways to move. The way that I move now, as a 40-year-old person, professional person, and I have these kids, but they're pretty self-sufficient these days because they're a little bit older now, is very different than, when I first had them and I had infants. And I just did a consult actually recently with a new mom. And we had to talk about these things. Do you push the baby in the stroller? Do you wear the baby? You want baby bonding that has to go with it. So that looks different now than it does for me now that my oldest daughter's 10. She doesn't need to go with me. We don't need that baby bonding time. That looks very different. So the mindset is still the same. How can I move more? How can I still get these things in? But it just needs to look different, whether it's time, children, job, whatever that looks like for you. There's still ways to think about it. So I want to bring out a couple research points here. So there's some good research recently that looked at people who sat or laid down, because it included their sleep time, for 23 hours a day, but they did go to the gym. They went to the gym for 1 hour. They worked really hard. They sweated it out. It was a killer workout. I don't, whatever that looks like for you. Those people compared to a group of people who never went to the gym, who never did dedicated, quote unquote, exercise, who never sweated it out and got that sick workout in, but they were active all through the day. They got up, they sat down, they picked something up, they put it down, they pushed it, they pulled it, they walked around for meetings, they got up, they got down. So instead of a steady state with a big spike in the middle and then a steady state, these people sort of had up, down, up, down, up, down, up, down, up, down. So that group of people who never did the dedicated exercise and sweated it out, those people had a lower risk of mortality, morbidity. They had better triglycerides, better BMI, lower waist circumference. So you probably are not expecting the exercise physiologist to say, don't do regular exercise. That's not necessarily what I'm saying. What I'm saying is you have to be able to move more. And if you don't have time or the resources to have a dedicated exercise program, you're still going to get the benefits of movement.
Yeah, I think that's a really great point. That's something, having done exercise consults myself in the past, is talking to people about this idea, because we get locked into, I need to be in the gym doing X, Y, and Z. And if I'm not doing those, I'm not succeeding. I'm not being healthy. I'm not doing any of these things. And that's, research is sort of showing, if we're active and moving, that's most important. And then you can add in those other pieces. And so it's been really interesting with the pandemic and having to work from home. I can tell just by logging my steps every day, even, that I am moving a significant amount less. So it's a challenge. It really is kind of that's a big change. And so I have to kind of dig deep with that sort of resilience and bounce back from that. How do I move more now that I'm in a different scenario than I was? Because when I'm on campus, I had meetings. We walk across campus all the time, and I'd get 10, 12,000 steps a day. And now I'm like hanging around 7,000 steps. And that's because I have 2 dogs who are very active, and we go on 20 plus minute walks every day, twice a day. So I have to find these extra ways to do that. And I think that it kind of leads to your point of focusing particularly on just getting more movement. So I think that's the essence behind MoveWell. It's not just exercise, it's movement and exercise. And that's really important.
Yeah, you just hit on a really great thing. You know, some of the tips that I give people whenever they do meet with me is get a dog. You just said it. You know, if you're trying to increase your steps, there's nothing like an animal that needs to go outside that's going to help motivate you to get up and get moving. So getting a pet like that is a really helpful thing. Not to mention there are other great benefits of having a furry friend, but just walking the dog can be a good start, a good first step for people who are not used to moving that much. Another thing that I tell people all the time is set an alarm. So if you're wearing some sort of device, a Fitbit, a Garmin, an Apple Watch, whatever, most of them have a setting where you can make it go off to every hour, or you need to get 250 steps this hour, and it'll vibrate or beep or buzz or whatever as a reminder to get up and to move around. So that's kind of nice whenever we get stuck in a project, or we get stuck in work, or we're really zoned into whatever it is that we're working on. It's nice to have that reminder to get up and move. And I'm going to kind of dig in here a little bit, but what I tell people is make it sensory, a sensory trigger to help you remember to move around. So for me, I like the buzzing on my arm. That works for me. I can feel that. But some people are visual, right? And they need that to pop up in front of their face. And so there are different apps you can even put on your computer to, like, the one of them that I like a lot is called Stretch Clock. And so you can download that, set it to go off every hour, and it will just load up your default browser, whatever you're working on. It'll pop up over it and lead you on a stretch for like 30 to 60 to 90 seconds, something like that. It's not hard. You could do it in your work clothes. If you're wearing a tie, if you're wearing a dress or whatever, you can do those things. So, it pops in front of your eyes. Some people need a sound. So if you need a buzz in your ear, if you, set an alarm on your phone, or on your computer to make a ding sound or a buzz sound or whatever that is for you. So usually a sensory trigger is helpful for people to remind them to get up and move.
Yeah, definitely. That's something I've used in the past as well. And I'm classic case of one of those people who gets into a project and it's really, really hard for me to break it once I hit a rhythm. And I can find myself sitting for 2+ hours at a time. And I know by virtue of my job, I shouldn't be doing that. But you get so kind of locked into whatever you're doing that you need that sensory trigger. And that has been really helpful for me. So I've definitely given that as a recommendation to people as well, or ways just to remind yourself to move more using those triggers of some sort, whatever works for you. And maybe you have to try 2 to 3 of those before you find what really sticks for you, kind of like an exercise routine or physical activity or anything like that. Find what works for you, find what you enjoy, and find those things that get you moving. So kind of switching gears just a little bit for those who are actually looking for exercise and digging a little deeper into that, what can listeners do to get the most bang for their buck when they are getting started so that they can meet those ACSM recommendations for physical activity, but don't feel like they're, say, stuck in the gym all the time or something like that?
Yes, that's one of the things that I talk a lot about when I'm talking to people is functional movement. And, at the beginning, you mentioned that that's one of the credentials that I have as a functional movement specialist. And the way I look at that is you want to do things that mimic the things that you do every day. So training for life, like I mentioned at the beginning, you want to do exercises or movements that mimic the things that you do every day, so that when you do them every day, it's second nature, and you're doing it efficiently, and you're doing it properly, and you're doing it safely. So and a lot of the exercises in the gym translate to that, but you don't necessarily have to be in a gym to do some of them. So think about a squat, and I'm only going to give a few examples here, but a squat. We sit down a million times a day. We sit down in our chair at our desk and we get up, and we sit down at the kitchen table and we get up, and we sit down in the car and we get up, and we sit down in the bathroom and we get up. That's a squat. So when you're doing things every day like that, that's going to be one of your main exercises that you want to do. Load it different ways. Put weights on your shoulders. Hold a weight in the front. Hold a weight down to your sides. Front squat, back squat, goblet squat. Those are all the same thing. Just because you're not in a gym holding a dumbbell doesn't mean that you're not still doing the same thing. And so that's a functional movement. It's going to help me to keep that function so I can get up and get down for as long as I live, as long as I keep on doing it. Exercise, no matter if it's strength training or flexibility or cardio, if we don't use it, we lose it. Our bodies detrain so quickly. We've got to stay up on it. Another movement like that would be a deadlift. That sounds like a big, scary exercise gym word, but a deadlift is really just hinging from the hips to bend down, softening the knees so they're not locked, picking up something heavy from the ground, and pulling it back up again, using the big muscle groups on the back of the body, the posterior chain. So your glutes, your hamstrings. I mean, if you pick up a child, you're doing this. If you pick up a box, you're doing this. If you even pick up a pin off the floor, you're doing this. Even though it might not be loaded, it might not be heavy, it's still a movement pattern that you are going to do every day. Another one might be a row exercise. So just because you're not in the gym with a pulley station and pulling on something, do you not open a door every single day? It's the same movement. So you want to do functional movements. You want to do things that are going to train you for the things that you do every day so that you can keep those patterns and those movements functional for the rest of your life. The other thing that I want to say is, if time is of the essence for you, and it is for me, and it probably is for most people, then you want to do compound movements. So movements that cover more than one muscle group or more than one joint. So again, a squat would be a great example of a compound exercise, because when we squat down, we're working our quads, our hamstrings, our glutes, our core is strong. We're getting all sorts of muscle recruitment in that exercise. Whereas if you compare that to, say, a leg extension in the gym, so you sit down, you put some sort of padding over your ankles, and then you straighten your legs, and you have some sort of resistance there. That's a great exercise for your quads, and only for your quads. I don't ever do that movement in my life. I am not a soccer player. I'm not a football player. I don't need to kick a ball really hard, really fast. I don't need to do that movement. I don't need to rehab my knee. That might be another reason why you would do that one. I don't need to rehab anything. So that's not going to give me the most bang for my buck, so to speak. I'm not going to isolate a muscle group like that just to work that muscle group. I'm going to stick with something like a squat or a deadlift or a row, or I'm going to recruit way more muscles where they're actually functional. I'm going to use those movements every single day in my life. And so they're going to be less time consuming, right? Because I don't have to isolate my quad and then my bicep and then my tricep and then my calf. I'm not doing them one to one to one to one. I'm doing a whole bunch of them at the same time. And so that's going to be the number one tip that I give people to help them to get more, like you said, bang for their buck.
Yeah, definitely. That's having, again, worked at MoveWell and done training sessions. Oftentimes, that's a lot of time where I would start, especially with people who were getting started for the first time or the first time in a long time. I would try to keep it very, very simple for them and cover all of those basic functional movements that we go through every day. Get those with compound movements so that they're not there a long time and they don't feel like they have to be stuck there. And so that it builds that habit a little bit better, hopefully. And so that's really interesting. And I think the training for life piece is, if you take that into a broader perspective, just training for whatever your goal may be. And so I think that's where a professional is really helpful in helping you narrow in whatever that goal may be, and then how to actually approach that goal as well. And just talking about those functional movements, regardless of whatever your politics are. Somebody like Justice Ruth Bader Ginsburg, I've seen her workouts. She does 22 minutes a day. She has a personal trainer, and it's basically breaks down to around 10 minutes of cardio. She does a few functional movements for about 8 minutes for resistance training, and then does some stretching. So she's covering all of those pieces of the ACSM recommendations and also covering functional movements as well. And she seems to be a person who is very resilient physically. And so I think that's a good kind of national example. That's not your typical person you would bring up, like your Arnold Schwarzeneggers or somebody like that. I thought that was an interesting thing that I saw, and it really helped me when doing training sessions with people as well, to kind of convey that idea of training for life and doing functional and compound types of movements. So to kind of wrap up a little bit, where can listeners dive a little deeper on this or similar topics? What podcasts, books, websites, videos would you recommend that may add value to listeners' lives?
Yeah, I want to mention Dr. BJ Fogg's work on tiny habits. And if you have worked with any of our health coaches, then you probably have heard of this already. But tiny habits are a little bit like those triggers we were talking about. And so I talked about sensory triggers because that really speaks to me, and that really tends to work for people that I've seen. But his concept is really more about using things that you already do every day in your life, like turning on the light, to be a trigger to remind you to do something that you want to do, like brush your teeth or something like that. So if you're interested in those tiny habits and those daily triggers, then you might check into Dr. BJ Fogg's work. The other thing that I want to say is, if you are looking online for exercise routines or workouts or trainers, then for sure you want to find a person. If you're looking for a person, you want to find a person who is credentialed. So don't just take their word for it that they're a trainer. Ask them, where did you get your certification? Is it an accredited certification? So you're not going to go wrong if you look to ACSM, like we've been talking about. You're not going to go wrong if you look for ACE, American Council on Exercise. You can go to their website, acefitness.org. They have a whole library of GIF files that show you the movements, and they show each exercise individually. And so you're not going to go wrong. So if you're looking for a person, make sure they're credentialed. If you're looking for just a website, don't just YouTube it, because my daughter who's 10 could post on YouTube and tell you what is the right thing to do. Just because it's on there doesn't make it true. So do your work and do your research there to make sure that you're getting good, legitimate resources. So again, acefitness.org, acsm.org. And then if you're interested in this exercises medicine, exercisesmedicine.org is also a great place to go, especially if you have some sort of condition. Like I mentioned earlier, maybe you've had an injury, maybe you've got a chronic condition. They have lots of handouts on what those guidelines should be and how to go about those things appropriately.
Yeah, that's great. And so kind of building upon that then, for our listeners that are UK employees, retirees, and their spouses, what do we have internally then, particularly with MoveWell, that is available to them if they want to dive deeper or learn more or get help on any of these things that we've talked about?
Yeah, so if you are looking for someone just to help you define what your goals are, figure out what your barriers are, what resources do you have, then start with a consult. See Ryan or I, we can do these over the phone, we can do them over Zoom, we can do them over email, we can do them one-on-one in person if that's, if you're comfortable with that. So do a consult with one of us and we can help you to define those goals, barriers, resources, make a plan that's really specific to you. And it can take into consideration, I'm a new mom, or I don't have any time, or I don't have a gym membership. That's okay. That's fine. We can still work with that. We can still give you ideas and plans and still help you there. So that's definitely the first thing I would do. If you already know that you want to have an exercise habit, then we do have our 2 fitness facilities on campus. So if you want to join up, then it's $7 a month to join with MoveWell. That gives you access to both facilities, all of our group fitness classes. You can guarantee that I make all of my trainers and all of my group fitness instructors not only be CPR certified, but certified in their specialty. So they're all legitimate resources for you to use. That's why they're there. The students are there to learn, offer their expertise, get that experience, and then the employees and retirees really benefit from that. It's really a win-win situation.
You mentioned the cost of joining MoveWell for the facilities. What about consults?
Consults are free. You can meet with us for free as often as you want, as much as you need to. And once you are a member, if you are paying that $7 a month, then you can do training sessions with the fitness staff. And those are free to members. So you are paying that $7 a month, but then you can also meet with a trainer one-on-one for free.
So finally, if you hope listeners take away one thing from this episode, what would that be?
Get up and move. That's my tagline. Get up and move. Whatever situation that you're in, look for the ways and look for the reasons and look for the potential for movement in your day.
Well, I appreciate you taking the time to chat with us and talk about mindset and talk about physical activity and exercise. So to preview some of the things that we have coming up with health and wellness, we've got a KORU mindfulness class that is starting on August 21st. That's a Friday. It's a 4-week session for that. There's also a KORU retreat on September 19th. That's a half day on a Saturday. Both of those are led by my first guest, Jackie Hansen. And we also have a mindfulness-based stress reduction all-day retreat with Dr. John Patterson that is coming on August 22nd, which is also a Saturday. That's more of a full-day deal, so if that's something you're interested in, listen through the end of the episode to see how you can connect with us and to see how to register for those things. You can also visit our website and click some of the links and wherever you're accessing this podcast, and you can see the show notes for some of the things that we talked about and these upcoming events as well. So we appreciate you joining us, and we hope to hear from you down the road. Thanks for listening to Becoming Wildly Resilient, a podcast series from University of Kentucky Human Resources, Health and Wellness. The UK HR Health and Wellness team, consisting of certified health coaches, fitness experts, registered dietitians, and wellness specialists, offer a wide range of online and in-person programming to University of Kentucky employees, retirees, and their spouses. If you enjoyed this episode, you can listen and subscribe to future episodes wherever you find your podcasts. Connect with us on Facebook, Twitter, and Instagram by searching @UKY Wellness. There, you'll find links to episode show notes and more. You can also email healthandwellness@uky.edu with any questions or suggestions for future episode topics. To learn more about well-being benefits offered by University of Kentucky Human Resources, visit www.uky.edu/HR/wellbeing. Live well.